In this video, I will talk about an ideal cancer treatment. It is effective, non-toxic, scientific, and universal, but has been hidden for 30+ years because it is not a moneymaker. It really is true. Let us bring this treatment out in the open. I'm an independent scientist based in the US. Name J. Kulsh. I did graduate studies in chemistry and biochemistry at IIT Delhi and the University of California, Los Angeles. I have published 3 scientific papers on this cancer treatment. The treatment is gentle electrotherapy. Full name: gentle electrotherapy to inhibit or block a pivotal enzyme, GEIPE, GAIP. To understand its scientific basis, we need to know 2 concepts of chemistry and biochemistry: enzyme and free radical. Enzyme. Whatever happens in the cells of our body happens thanks to one or more enzymes. These are the skilled workers of the cells, each with its own expertise. They are made of protein. Free radical. All chemical bonds are made of electron pairs. An unpaired electron is very reactive, constantly trying to pair up. If, for some reason, an electron remains unpaired, it is called a free radical. This happens extremely rarely as an exception. In nature, free radicals are found only under very special circumstances. One such free radical is linked to cancer. The biochemistry of cancer. When cells in any part of our body start dividing uncontrollably, this unrestrained growth is called cancer. The enzyme that plays a central role in cell growth is ribonucleotide reductase, RNR in short. The name I will use. It converts the molecules that build RNA into the ones needed for DNA. Without RNR, cells can't make DNA, and without DNA, new cells can't form. All cancer researchers agree that if you can disable the enzyme RNR, you can stop cancer. Since the 1970s, chemotherapeutic drugs have been designed to block the activity of the RNR enzyme. However, these drugs are only partially successful in doing so and are toxic to healthy organs, causing significant side effects. Another method for disabling RNR was conceived in 1994. To understand this, we need to look at the structure of this enzyme, where a free radical is located. RNR's unique structure leads to an effective cancer therapy. The free radical at the active site, or heart, of RNR is essential for its activity. If it is destroyed, the RNR enzyme becomes impotent. All its activity ceases. This halts cancer growth. It occurred to me, what if we pass a mild electric current through the cancer? Electric current is nothing but a stream of electrons. The lone electron of the free radical will find a partner to pair with. With the free radical thus destroyed, the activity of RNR will end. The cancer will stop. This is not a mere speculation. Experimental evidence confirms this proposition. Proof of the effectiveness of this therapy. By 1994, 10 scientific studies on cancer electrotherapy had been published. They all confirmed my idea. The best results were in an article published in 1985. 98% of tumors in hamster disappeared. Virtual cure, after passing 2.4 milliampere current for 5 hours. The researchers were astonished at how and why this happened. I wrote to all the major cancer institutions in the United States about this new treatment. Only 2-3 responded. Top cancer centers validated this new treatment. National Cancer Institute, NCI, MD Anderson Cancer Center, Houston. These are 2 top cancer research centers in America. Both said my treatment ideas are very interesting and worth investigating. The NCI suggested I go to the City of Hope Medical Center near Los Angeles, where a study on a similar topic was being conducted. There, I happened to meet a scientist researching the RNR enzyme. He completely agreed with my ideas, but the management blocked the exploration of gentle electrotherapy. Cancer centers refused to advance this therapy even after calling it worth investigating. No cancer institute wants to work on this treatment because it will hurt their cash flow. In 1997, after my scientific article on this subject was published, the Tata Memorial Hospital in Mumbai, the top cancer institute in India, expressed a desire to collaborate with me to explore this therapy. However, they lost interest during the process of making the necessary equipment. Desperate, I built a device myself and continuously improved it. Through the website cancer-treatment.net, I occasionally found patients whose near-surface cancers could be treated by this therapy at home. Many were healed, as you will now see. In 2007, a doctor in Nigeria improved the device I sent him and completely cured a woman's palate cancer. In 2008, an electronic engineer in Florida, USA, built his own device and fully healed his father-in-law's Merkel cell carcinoma, which is the most dangerous type of skin cancer. These results were published in a scientific journal. In 2010, I got an electronic device manufactured for this treatment and went to India. Most cancer doctors in India refused to collaborate, but one doctor in Agra consented. He provided a patient who had cancer of the cheek lip area due to tobacco use. He was able to eat after 2 days of therapy. In the photos, you can see the improvement after 5 weeks. But then he visited his village and fell ill there. We were unable to complete the therapy. Below are photos of an 80-year-old woman who had a very large tumor on her eyelid, which gradually shrank with this treatment. We could not finish the treatment because I had to return to the USA. Due to financial constraints, I was unable to work in this area for 12 years. But in 2022, I started looking for patients again. Found an American lady whose 2 tumors on the eyelids totally disappeared with the GAIAP treatment. This patient had melanoma, a deadly form of skin cancer. This therapy made it go away in a matter of a few months. This nurse had a tumor on her scalp. You can see how it decreased and disappeared. This patient had a large cancerous lump on his shoulder, which melted away in about a month with this treatment. It will take a little longer to heal fully. All these examples prove that this treatment works. It was already challenging to find patients, but now, due to Google's artificial intelligence, very few people visit our website. This is an ideal cancer treatment because it is effective. You have just seen many examples of this. It is non-toxic, unlike chemo or radiation. No fear of nausea, fatigue, hair loss, weakened immune system, etc., with gentle current. It is scientific, based on biochemistry. It is universal, applicable to all cancers. From a biochemical viewpoint, cancer is a single disease regardless of which organ of the body it affects. Currently available home remedy is limited to external tumors. But in a clinical setting, such as a hospital, internal cancers will be equally treatable. It is very affordable, the most inexpensive. The misfortune of this therapy and the misfortune of cancer patients. When 2 patients were fully healed by GAIAP treatment, I reached out to the Tata Memorial Hospital in Mumbai again in 2010. It responded again. The director and I exchanged many emails, but after the 7th email, he went silent. I'm very grateful that Tata Memorial showed interest twice. I have contacted all the major cancer centers worldwide several times, but none have shown any inclination to explore this treatment. The Tata Memorial balked both times after initial interest. This behavior suggests that they find my GAIAP treatment promising and rational. But when they consider all the implications of adopting a treatment that could revolutionize cancer care, they get anxious and withdraw. If a highly effective therapy also drastically reduces treatment costs, it threatens the financial model hospitals rely on. This economic concern seems to outweigh the welfare of patients, leaving them with a dismal status quo. How to establish ideal cancer therapy? Clinical trials for this cancer therapy aren't feasible because they cost tens of millions of dollars. And since there's no patentable protocol, investors have little incentive to fund them. However, this treatment can still be established if a government or a nonprofit takes an interest in it, or if the public learns about it and puts pressure on cancer clinics. This therapy can be offered to those patients who are averse to or not suitable for traditional toxic cancer treatments. There is no downside to this inexpensive, non-toxic treatment. If a high percentage of them see benefits, as is likely, the word would spread, and more patients will opt for it, then it will take only 1 to 2 years for this treatment to become established. Please join this international petition to transform the current gloomy landscape of cancer treatments. The link is given. For more information, please visit the website cancer-treatment.net. There you will find letters from various cancer institutions, scientific articles, details of treated patients, and other material. Please tell others and spread the word so a new age of cancer treatment may dawn. Cancer will no longer be dreaded.